Tyrone, I don't hear the intro, but if it does show, let me know. Good evening, everyone. I hope everyone is doing quite well. Um, I am not the face that you wish to have seen because I don't look as good looking as my co-host. However, you have to deal with me this evening. My co-host is out doing something else that she needs to take care of, but I have another beautiful young lady joining me as
Thank
well
you.
that we are sometimes referred to in the COVID world as Batman and Robin with a Y. I have Dr. Kim Barbell Johnson joining us. Dr. Johnson, Kim Barbell Johnson, sometimes I call her Dr. K. Dr. K is my expert that I go to as it relates to COVID and ongoing research. Whenever I have a question or concern or just want to know something. And so, how are you doing this day, Dr. Barbell Johnson?
I'm doing great. Can you hear me okay?
Yes, I can. I'm presuming our technology guy will let us know if we were not being heard quite well.
Tyrone is excellent indeed.
So, I thought today's show, what we wanted to do is just have a candid conversation about COVID in lieu of all the concerns that we've been having about a new variant. I think I thought I'd just like for us to start off a discussion or have a discussion this week about COVID. But before I get to the variant, what I like to do is, I'm not sure if you have anything in front of you about the latest numbers on COVID here, either in Florida and the U.S. But off the top of your head, because I know you're so smart, that you probably know most of this stuff.
I do.
But what can you tell us? Let me just ask you for a brief summary about COVID and what's your thought on as it relates to COVID.
So we are still in this pandemic. So let's start there. That we are still in an international space with the nuisance that is COVID-19, the disease. SARS-CoV-2, the virus, has morphed and changed, and we are dealing with multiple variants around the world, with the variants of concern being the one that you mentioned, Omicron, and the one that we have most in this country, Delta. So, where this virus and this disease is concerned, we are still here in the midst and in the thick of things. Now, with that being said, since the World Health Organization, the United States, named an emergency and called this a pandemic, we have come a long way, and this disease has looked differently and have affected people differently, and our numbers, while they are stabilizing in many places, our numbers are still continuing to increase. So let me just pull up, I hate to actually just cite specific numbers, because whether you go to Hopkins or depending on the site that you look at, the numbers might change. But I think what's important to realize is that we are still dealing with the pandemic, number one, where the numbers that are increasing, we are seeing an increase in COVID in certain parts of the world. In our state of Florida, those numbers are relatively stable. For those who've been following the media, there's been some kind of mix up with numbers and reporting over the last couple of weeks. So in terms of the accuracy of our numbers, I can't really cite those, but the trend still is that we do have a continuing number of new COVID cases daily in the state of Florida. Our numbers of hospitalization has gone down. And for the most part, when we're looking at the country, the most unfortunate part of the statistics is that most of those who are hospitalized and ill with COVID are members of our younger population. So again, representing the fact that this disease continues to be a disease of the unvaccinated. And as we see younger folks, and I'm talking about pediatric age patients, we are still really trying, despite the new approval for ages 5 to 11 to be vaccinated, we are still trying to get our younger residents of our communities vaccinated. And until we do that, I think we're going to continue to see the same trend of increased COVID cases. And I don't want to get too far into the politics because I know that's like asking you to have a party. but I will say that, this is not, it's not by happenstance. It's not like the numbers are increasing simply because COVID likes teenagers or pediatric patients. It's simply because of our social choices and kind of the fact that we have kids and young adults and unvaccinated people in our community. With the challenge for us to vaccinate those members of our community. And we still have a lot of people whose personal choices are such that they are continuing to allow this variant and the Delta variant, that is, and this disease to perpetuate itself within our community. So that's basically the trend. And unfortunately, we're still here with COVID-19.
So to recap, I just want to make sure everybody understands that still the most dominant variant of the virus is the Delta virus.
Absolutely.
And it's still just as deadly and as I'm gonna say worrisome, just as a warrior as it has been in the past. And it really puts us, it has killed more people than the Omicron has. And as a matter of fact, we're still, if I'm not mistaken, and I'm gonna let you elaborate on that, we're still in the dark about how severe Omicron is as it relates to the symptoms and the mortality, meaning its kill rate, and is the degree that with which it caused sickness. We're still trying to figure that out.
Yes, right, and so you're absolutely right. So it's important that we don't take our eye off of the prize. The information that we have has been helpful to get us to where we are in managing this disease and managing our families and trying to create some kind of normalcy of life. And that information has come from watching the original COVID-19 disease and the original SARS-CoV-2 virus emerge and evolve in communities. Omicron entered into our space, or the newest variant that is now named Omicron entered into the space, what we believe was in the southern parts of Africa, being the first case. And once that variant was genetically identified, it was important for us to keep an eye on that. And it wasn't because it was more deadly or more anything. It was just that it was different. And unlike our other variants that we'd seen before, as we have talked in this COVID space about spike proteins and about changes of the virus, Omicron was different. So the spike protein, which we've talked about, is basically the part of that virus that allows it to connect to our cells. The spike protein of the Omicron variant is really different than any other of the variants that we've been concerned about, and Delta being one of them. The spike protein itself has so many genetic changes, more than 27 genetic changes, that it is possible that because of those changes, the virus has gotten smart enough in communities, whether it's ours or others, to evade our natural immunity or our vaccinated immunity. And we don't know that yet. We don't know the extent of that yet, but we've not in this research space seen all of those combination of changes together like we do on the Omicron variant. That's the bad news, good news. The good news is that while the numbers have been changing every day, we've seen that this started out across the Atlantic. We now have cases of Omicron in the United States in multiple states and cities within the United States as close to us as Georgia, possibly even Florida. From the surveillance that we know that we've done in this country, we've seen that Omicron so far has proven to be what we think will be at least very highly transmissible, meaning that because of these changes and nothing to stop it, it would be easy to catch COVID, the Omicron variant. But we haven't had any evidence, thank God, to this point that says that it's more deadly or more serious. Now, with time, that can change. And until we let time be time, and we must continue to prepare, we can't just let the virus come and wait to see who it kills. So we are being very aggressive in our communities to step up some of the things that we have been doing in the past. And so when you listen to the CDC on the news or listening to our local experts within our communities, they're now talking again about how do you order your steps for the holidays? What do you do with masks again? All of these common sense things that we've been promoting, Batman and Robin, all of these sense things that we've been talking about for months and months and months. If you've been doing them, continue to do them. But if you got lax or you got a little bit liberal in your behavior when it came to decreasing your risk of COVID-19 because of Omicron and the uncertainty of Omicron, and because we continue to have the need to vaccinate many more members of our community, it's very important that we keep our eye on Omicron, but continue to do what we know to do with regards to masking, social distancing, testing, because Delta is still what we're dealing with, and Delta is still a beast. Delta has not changed its face. Delta may have some competition from Omicron or another, Greek lettered alphabet variant down the road, God forbid. But should that happen, we're hoping that we use the lessons learned in the past about how not to get sidewinked, how not to have this virus in our blind spot. And to affect our community. So there's a lot of Omicron talk as it's new because we're still not sure how it's going to perform. We are not going to let our guards down as a scientific community, as a health community. But you are 100% spot on. We are still in the midst of Delta, and Delta is the variant strain. And there are only two variants of concern that we've had: Delta and Omicron. So again, this is the cousin. Very different cousin, but this is the cousin, and Delta is still causing havoc. And again, it remains the most dominant strain in this country. And as those numbers change, this information might change. But for right now, we're dealing with the Delta variant.
Yeah, let us not forget that Delta does have a track record that is very reliable. That is in terms of how severe it can present.
It changed the game. I mean,
it changed the whole game.
Delta came in this last summer. When we saw Delta, we were at the point where we were like, okay, we know what we're doing with COVID. The symptoms that patients presented with started changing. The age with which patients presented changed. Delta was a total game changer when it came to COVID. And I think it was a respectable game changer. And while people have their opinions about the severity of COVID, because everybody knows somebody who has survived COVID, Delta allowed us to look at COVID very differently. The first 100 days of this pandemic, we saw old people, people with chronic disease, minority populations being most affected by COVID-19. By the time we looked at the 100 days of Delta, once it was in full blown, we saw numbers that hadn't increased since last year, increasing in terms of just COVID-19 disease. And then when we look, those numbers of people were getting more white, more rural, and more young. And so it covered the entire spectrum. So we definitely have had to look at Delta with not only a scientific community eye being concerned about it, but Delta came on top of a vaccinated community and still did that to a vaccinated community. So it's definitely still to be respected as a variant.
And, a lot of that revolves around because we didn't know. It was this. I mean, truth be told, the COVID-19 is a new virus, a new entity that we were presented with, and we had no track record, no history with COVID-19, period, whatever the variant was. Okay, Lambda, Delta, Omicron, whatever Greek alphabet it was, we had no history on it. As time went on, the thing that I tell my patients is we began to see some things that happened or was happening that we had to adjust our game. It's like playing football to an extent. You may go out there and you think the team that that you saw in your review of the team
game book
reels and stuff. Yeah, this is the play they do that, and then all of a sudden they throw a new play at it.
Yeah,
So they present like it's a whole new team, and now we're trying to figure out how to deal with that particular team. So that's the best I can do with a football analogy. The bottom line is we did not know what we were up against. We have a better idea, but even with that, and we can talk about it, we still have the proverbial long COVID.
Right. And you're absolutely right. And, I think that's one of the things that's most interesting for, we're not that different in age, but generationally, how we studied medicine, we basically studied the same medicine. And this is the very first time that we've ever really, within our generation, dealt with something like COVID, where in real time we are readjusting our steps, and we are sometimes going back on what we told patients about things. And we see how we're in bed in the medical space with the political the political partners. And again, politics aside, it's been so confusing for the lay person. It's been confusing for the medical population. And we're learning as we go along. So sometimes information gets shared, that becomes a fact or the equivalent of a fact. And the minute that we need to change, because when you know better, you do better, right? Because we need to change. We have sold a bill of goods to the American public where they think that we're backtracking or we're changing our voice or we're changing the science, and it's not that. It's because this really has been novel all along. And while we have entered this space with a new variant, we have really lent our scientific community the power of what we knew about vaccines, vaccine platforms, about previous MERS and previous coronaviruses. We've brought everything to the plate in a way that we never did before this pandemic as a world community. As you know, bypassing all sorts of legislative and structural barriers that normally stand in the way of vaccines, that stand in the way of therapeutic evolution, of bringing treatments to market, sharing information international. The barriers that were in place prior to this pandemic really limited a lot of growth in the scientific and the research space. COVID at least brought us together on one accord and brought everyone to the table, the best minds to the table. But it's really been unfortunate that while that has been the case and that's been a positive, that it has gotten muddled with a lot of the politics, exactly, the politics, and sometimes well-meaning, but oftentimes not well-meaning, just kind of not thinking recommendations and conversations that have played themselves out in the wrong spaces, whether it's social media or television. So we've learned so much, not only about this virus, but about our community and about culture in this COVID space, that it continues to be exciting from our point of view, but it continues to be deadly. And we need to move. We need to do everything that we need to do to continue to get past this.
You're absolutely correct in that we must realize that politics has played a role in the way that our treatment and our success at attacking this virus has come about. When people politicize things, and scientists are giving recommendations because they're scientists versus non-scientists giving recommendations because of either political aspirations. I won't call out any names, as far as
just look at certain states. You're right,
right.
And that's unfortunate. And again, what I hope doesn't happen though is independent of, and I hope everyone voted today, but in Duval County at least, but independent of your politics, I hope that people don't cut off their nose to spite their face, you know? So there are people, unfortunately, who are so sick and tired of the politics that are like, you know what, forget all of it because I don't know who to trust or I don't know where we are. And let's just kind of bring it back to where we are right now, because we've been hearing the same thing for months and months and months. And so right now, as people are hearing about Omicron, for example, the question that I'm getting from my family members, friends, and patients is, well, if we're not sure yet if what we have is going to help us with Omicron and others are emerging, should I not wait to get vaccinated? Should I not wait until something is better and, you know, save the purity of my body or decrease the risk to my body of something that isn't going to work anyway? Because there's a chasm of information that patients don't get, and people don't necessarily understand about just how immunity and infection control and population medicine works. So let's just start there. So for those who may actually be hesitant for a number of reasons and heard, well, Omicron may not be as responsive or vaccines may not be as responsive to the Omicron variant, and that, you know, may have heard Moderna say in 100 days they can reformulate their vaccine to give us another variation. And, you know, the smart thing to do is wait 100 days, you would think. But
no, you can die in 100 days.
In 2 days, right. And unfortunately, what happens is there is that possibility of variant changing. We don't have the evidence to say that what we have currently with our current vaccines is not working. What we have is the concern that variants, Omicron or others, our host immunity, the immunity that we have, whether you've had COVID or just because you're healthy and you have a good immune system, that our host immunity the virus might escape our host immunity, or if we're vaccinated, may escape our vaccine immunity. And if that's the case, then we need something so that it can escape, right? So that is the concern. We don't have the evidence scientifically yet that that's happening where we can say that anything is a failure. And why is that? Because from the beginning, Dr. Kane and I have been on this path saying that there is nothing that exists in the COVID vaccine space that has been designed to decrease your chances of getting COVID-19.
Right.
Vaccines were developed to decrease your chances of having moderate to severe disease from COVID-19, hospitalization and ventilation. And in doing so, we were able to decrease the burden of diseases on community. You may have COVID, but you don't get that sick. Well, that's still the case. You may get COVID, but you're not getting that sick. So because we have more COVID doesn't mean that it's a failure, or should we have more COVID? It doesn't mean that it's a failure of the vaccines. What we need to do is prevent burdens of death and serious illness on the communities that COVID has just taken havoc on. So we are still at a place where I think we need to just always remember that our vaccines as an individual choice of protection for you and those that are around you, and as a community, vaccines are working. Omicron, if you want to look at anything else, and I will not cut you off anymore, I promise, I don't promise because I tend to do it inadvertently. but Omicron, when we look at where this started, let's just look at the common sense. In the population where Omicron was discovered and genetically, the vaccination rates of those community were less than 10%. So in the least vaccinated places, the opportunity for variation in this virus, for variants to emerge, was created. It was fertile ground for variants to emerge. So what's the flip side of that in just simple common sense? Less vaccinated, variants emerge. More vaccinated, variants less likely to emerge. And so it's like having a community of people with, security systems on their door. You're going to go to the house that doesn't have the security system and try to get into that house, right? So if we all have some degree of Ring or ADT or whatever, security system or government pinchers or whatever our security system is, if we all increase the security for our communities, we're less attractive for people to take advantage of us and to rob our homes. In the very same way, scientifically, and it's a stretch, to make this into lay conversation, but in the very same way, that is why we need to increase our rates of of immunity in our communities, because we are protecting ourselves, but we're also doing an incredible job to increase or decrease the chances of variations that are deadly within this virus impacting our communities.
Well, they have to, what I tell patients, what they have to remember is a couple of things, and that is that, as you said, we don't guarantee that you would not get the virus just because you got the vaccine.
Right.
They hear 95% and they think, well, 95% prevention of getting COVID-19 or getting ill from COVID-19. Nope, that's not what it actually means. Just, 95% of the people that are vaccinated, even if they get COVID, have a lot less what we call morbidity or less illness.
Exactly.
And, or a severe illness. And that's exactly what you run into. And your analogy in terms of using the an alarm system at the house, that even if the criminals break in, when the alarm bell goes off, they realize they have because they're just going to go from house to house and try to enter a house. They may not know there's an alarm system there.
Right.
But when they kick the door in and the alarm goes, they run away.
Yeah, and people and your neighbors are rallying. Your immune system is rallying. Exactly.
Yep.
So
and every time that another thing to remember is every time that this virus infects another person, it's an opportunity for it to morph itself, because it is trying to survive just like you and me and everybody else is trying to survive in this world. And so it's a chance for it to be able to, create a circumstance or an environment where we won't be able to kill it off as well.
Right.
So that's what it's trying to do. It's trying to survive.
Right. And there's a subset of our population that is really stuck on numbers, both the gravity of the numbers that we have, but also the fact that we don't have as many people dying of this disease versus that disease, and we're doing all of this for this disease, and X number of people are dying from other diseases, and short of gunshot deaths in our community, I think we need to stay where we are, where COVID is concerned, because there are other things that are killing us, but our numbers are still impressive. But more than that, I think one of the things that we lose track of when we're promoting these high numbers and we're promoting the numbers, the aggregate numbers, is that all it takes is one family to be impacted by this negatively for their world to change. And, I just lost my dad exactly 2 months ago today. And, the impact of losing one father on my household was huge. So if COVID had affected one person, I would probably still be as passionate about COVID as I am. But just think about that magnified in terms of all of the children and parents and grandparents and aunts and uncles and aunties, that we've lost largely, because of something that could have been prevented. Lately, because of disease, because of things could be prevented. Often that could be prevented. And it's really unfortunate that we are in this space where while the numbers are impressive, we must really kind of get back to, hey, Jocelyn, we must get back to the point where we kind of understand, as we walk around healthy, that it's that ability for me to inadvertently infect or impact someone else. And that one person is the one person that really could be inadvertently suffering because of a decision that I make. And if for nothing else, we should be super vigilant and extremely concerned as our brother's keeper, and for our own health. So,
well, let me say this real quick, and then I want to bring Ms. Turner into the phrase since she's here.
I'm so happy to see her.
Same here. The one thing that I will say, since you mentioned the family, and I think some of our viewers have heard me say it before. I know Ms. Turner has. I've had a family of basically that they were 6, and 4 of them died from COVID within a week of each other. And the survivor, whom happened to have been vaccinated, even though she got COVID as well, but her illness was not terminal like the rest of them. The survivor she is left with the aftermath of trying to take care of her sister's child, trying to deal with the death of her grandmother, her mother, and her sibling, okay, or two siblings at the same time. And that has to be very difficult to do. All I can ever tell her most of the time is that I'm just happy I'm not having to do what she has to do. Okay, I mean, I can't tell her I know how she feels. I'm just happy it's not me, because that had to be devastating to her whole world, and it still is affecting her. And truth be told, she still is having some of the long COVID symptoms, which we can get into at some point in time. But hello, Miss Turner. How are you this evening?
Good evening. I know you all thought you weren't going to see me, but you know you can't get rid of me,
we
right?
are so happy.
You know, when you get scientists to go talking and talking, we can talk for days, but that doesn't mean we necessarily relating to the non-scientists as well as you can. That's why we tag team the way we do.
That's why we need you. You're like our interpreter, you know. So.
Oh, wow. Well, listen, I want to ask you both a question and tell me how you would answer it, because this has been something that a burning question that I've been getting from people is, so I've been vaccinated and I want to plan on just living life again. I've had my booster. I want to get together. Is it safe for me to get together with friends who are also all vaccinated, and matter of fact, they've all received their boosters? What can I do different as far as socializing than if I were a person who had not gotten any vaccine?
You know, that's a really great question. And it's one that I'm also getting on a daily basis. So let me back up and just say that we are all hungry to socialize. And while, you know, I'm a scientist and I'm encouraging masking, you know, the truth be told is, in true transparency, I've sat at Madison Square Garden just a month ago, or within the last month, with 22,000 reportedly vaccinated people. We all had to show our the vaccine cards for, you know, the Dave Matthews Band concert, for which my cousin is the musical director. I've also sat in multiple thousand theaters following my son around the country. And in those states, I also had to show my vaccine card and sit in a theater for 2.5 hours watching his musical with, you know, with a mask on. So I've had to mitigate my steps as I try to enter into this, you know, elective space. I mean, I didn't have to go, but right. I wanted to go. It was good for my mental health, and as a mommy, I had to go, actually. But so to your point, there is no situation that's zero risk, right? So these situations must be decided on very individually. And if, depending on your risk, if you've got medically fragile members of your household, if you yourself are medically fragile, if you are concerned or you are not open to more than, you know, a few percentage points of risk, you probably need to be as conservative can be, close to that bubble space, right? But if you recognize that the spectrum of health includes spiritual and mental health, you might be free of infection, but you may not be free of anxiety and other things that actually are very important for us. And as family physicians, Dr. Kane and I probably come down very similarly on this, that health is wealth, right? So you must actually find that balance. And it is easy, it is very easy to get taken by the rope down this COVID lane, and we forget about our spirituality and our mental health and our need for connection. So don't dismiss the need to connect because of COVID in any sense, but make your decisions as with as much common sense and as carefully as you can. So these are multi-layered ways in which we risk mitigate for COVID. So if you and all of your friends are like us, boosted and ready to go, ready for Christmas, right? And you choose to be inside, obviously you're not going to eat Christmas dinner at a table 6 feet apart. Obviously you're not going to eat holiday dinners through your mask. So you can choose to do that on a trust, you know, you're vaccinated, I'm boosted, we're all good. We all have not been out there at the town center unmasked. So our chances are, especially being asymptomatic, are relatively small that should we get infected with the SARS-CoV-2 virus, given our boosted immunity, we'll probably be okay, right? Now, what can we do as an additional step for that? And that's what I have to do when I actually go to visit my son, because they're on tour. So their travel bubble is very tight. So I have to have negative random or the Binax now, the home test. I have to have negative tests within 7 hours of any group event with the cast members, because even though I am vaccinated and even though we have all of these, layers in place and I'm wearing my mask, one of them, if I infect my son and he infects one of the cast members, that, the domino effect of that. So it's the same decision. So you have the opportunity to do things like outdoor spaces in Florida versus indoor spaces. Where they are in Rochester, New York, not so much, right? If you're going to be inside, you can make sure that people are truly asymptomatic and ask your guests. If you have as much as a sniffle, please do an at-home test before you come. It's not 100%, but it's usually higher in a symptomatic patient of detecting COVID-19. Or you can just make those decisions. I'm getting a lot of feedback here, but just make those decisions to be as conservative as possible, because while it would be great to enjoy life as if COVID didn't exist, there are consequences. And should you have a decision, or you make a decision to do large group events like I did a large group event, I did random testing every other day to make sure that I had serial negatives before I was a little less conservative with my activity. Wearing my mask every day after that, traveling, is an additional risk. So whether I was with a large group in a concert hall or just traveling, doing those things to protect not only myself, but the people that are in my life, and professionally, that means patients, that I made sure that I did those extra layers. Is it a nuisance? Absolutely. But it's the most important thing that I could have done.
Let me interject just one variable. Before Omicron, I would have just, Ms. Turner, you and I have had this conversation, because when it comes down to getting families together and everybody's vaccinated, a lot of times when you assume, what that means,
right?
That everybody is. But if you are those people that say they're vaccinated are telling the truth, which I've seen where people lie, but let's assume that they're all telling the truth. Because of the contagiousness of the Omicron variant, because it's much more contagious.
We don't know that yet. We presume that it is, but Delta is contagious enough.
Right, it's contagious enough. But still, my point is, because we
the
don't
unknown,
know,
right?
We still need to take those extra precautions.
Absolutely,
making sure, if best we can, let's do those things that we know work in terms of trying to protect you from others that may have the virus. I had a patient ask me the other day and says, well, they really want me to go back and sing in the choir. And they asked me, what should I do? And I'm going like, no. I said no, because that's one of the more highly infectious environments that you can have.
Right. And we learned that early.
But wait a minute. I have to ask, as a former choir member who's also considering going back. So you're saying, Dr. Kane, if my choir stand is really big and we can socially distance 6 feet apart, okay, so because a lot of us have just been uncomfortable about going back, so we could be 6 feet apart. And staggered in the choir stand, should I still make a decision if all choir members are vaccinated as confessed? Could I make the decision safely go back to the choir?
Again, you have to look at your risk, and risk is not only to you, but in your case, knowing you like I do, you have an elderly a family member that when you make that decision, you're not just making it for yourself. You're making it for them as well. And truth be told, if I'm in that decision and it's my mom, I'm going to elect I can't sing anyway, so I don't have to make that decision. But I'm going to make the decision, no, I will not get back into the choir, because at least at this time, because there's a lot of uncertainty as it relates to Omicron, and even with the Delta, even when you're vaccinated, you still can get infected with the Delta variant. You may not get that sick, but you can still spread it.
Right.
And
So since you said that, I would like to ask both of you, because somebody I know, and I know it's happened with you, but just I'm a regular folk. I consider myself a regular folk. You all are not regular folk because you're the physicians, right? So for
We're
us,
regular physicians.
right.
for us non-physicians and some of our listeners who are watching or listening, and if they unfortunately test positive, a lot of people just don't know what to do. Okay, what do? I tested positive, even if they have been vaccinated or not, and they happen to test positive. What's the first thing that they should do? If you want to give this is the top 3 things you should do once you know that you've tested positive, what would you say? I'll go with Dr. Johnson first.
Number 1, quarantine. So get out of everybody else's way and quarantine. That's the most important thing that you can do, symptomatic or not, you're positive, correct? Number 2, therapeutically, if there are monoclonal antibodies within your community, get monoclonal antibodies, and they are still located in Jacksonville for free. That is not going to cure you early in the illness. It will be, the closer you get those to the first period that you either find out that you're positive or symptomatic, it's going to decrease the burden of the disease, technically decrease your viral load, and help you to fare better. Number 3, and it's kind of like 3A and 3B because I actually need 4. Monitor your symptoms, because COVID meets you where you are. So you're positive today, but that might not mean that in 5 days you're just positive. With all of that, you may be positive and short of breath or positive and fine. You don't know. So be mindful of the symptoms of changes in your baseline, such that you're not sitting at home waiting for your respirations to be 90%, or you're not sitting at home waiting for a 103-degree fever. If you are feeling ill and your health is failing, you need to seek medical care. And that could be by telemedicine or to an acute care or to an emergency room, because there are other therapeutics that are not available in the outpatient space that may help you to survive COVID. And we don't have a way to flip a coin anymore because of Delta, really, to see who's going to live and who's going to die, right? So we must make sure that patients are given the anticipatory guidance that because they're positive, they're COVID and positive COVID, to make sure that they monitor their symptoms and seek earlier than later intervention. You know, the 3B was really just about social action. So if you have the opportunity to let those who you may have been around know that you are positive, to pick up the phone, because unfortunately our contact tracing in our communities are extremely overwhelmed. Our systems are overwhelmed or non-existent technically. So I think there's also the ability to decrease the burden of COVID by informing someone else that you were around within 3 days of your positive test, so that they too can get tested and similarly pull themselves out of the community and not infect others, and actually have the same opportunity to get intervention. So that's my 3. Dr. Kane, I'm sorry if that was 3.5.
Well, I would have to concur with what you said. The only thing that I probably is pre-COVID, before you get
That was going to be my,
the next question. Yeah, I figured as much. Before you get COVID, there are some things that you can do. Obviously, you know, the good old have the mask available, all that other stuff, have it available, wear it when you're around other people, blah, 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 blah. But the other thing you can do, I ask my patients to go and get, there are 4 devices that I want my patients to get to help me telemedically take care of them. I want a blood pressure cuff. I want a pulse oximeter. I want a gun thermometer so you can check yourself and anybody that's visiting. And
you said gun?
Thermometer, yeah, just a
infrared
thermometer.
Infrared. Let's correct it.
An infrared thermometer that we can get. And one of the other things, because I'm also having patients, I'm not sure where this is coming in at. There's that device that I do like to have a lot of my patients, particularly since I have senior patients, and that is something called Cardia, Kardia, or one of those EKG type monitoring devices for which they can send me what's going on with them as far as rhythm or an EKG, a single
I got mine. You told me you suggested it to me, and I actually got mine from Amazon. But I want to go back a second on the BP machine. Is it okay if it's battery operated, or do you prefer electronic?
It can be battery operated, but you just have to be very cognizant that you need to change your battery frequently, and don't just trust the battery indicator on the screen. If you know you've been checking your blood pressure, I have some people check their blood pressure 4, 5, 6 times a day. There is no way that battery is going to last 3 to 6 months, and you checking it that often. So be cognizant of that. If you're going to do it, at least have fresh batteries. Ideally have both, so that when you're not when you're not able to stick it in a plug and monitor your blood pressure, when you're not able to plug it in, you at least have a battery's backup.
So the question from one of our guests, hey Jamila, says, what should the caregiver in the home do if a family member tests positive?
I can tell you what we did, okay? And this was early on in particular, before vaccine. But, one of my daughters, actually, I had 2 kids to test positive. But the first time around, my daughter, we were able to isolate her in her own room, and as her room had its own bath. I was blessed enough to have that. So we isolated her. We took everything to her. She didn't have to come down and intermingle with the family until we could get where we felt that she was no longer contagious. Of course, that's testing, and her symptoms when her symptoms resolved, and we also did a test and were able to show that she was no longer.
How many days after she tested positive did you do the test to determine that it was a safe zone? Safe, potentially about 5 days, 7, 3.
We personally, we went at 7 days because we had the luxury of being able to test and then test again.
Gotcha.
So
I just wanted to weigh in here for a second, because we're talking about caregiving to like older, but they're also the need to caregive to younger people where they can't take care of themselves, and we are in their household, right? So actually the CDC on yesterday just actually defined recommendations for caretakers of mothers who may be positive with a newborn in the household. So caretakers of newborn, and they actually gave defining recommendations for how to test. Those recommendations said that if you are a family member providing care to a newborn, for example, and you had a known exposure to a positive case, if you're asymptomatic, to test 5 days after your last known exposure. If you are symptomatic, test as soon as possible within 3 days of your exposure, and retest 5 days after that. So there's the need, and I mentioned early on the top of this show, what we're not doing as much as we used to do is test, right? So we must remember that the tests aren't perfect. In fact, the FDA yesterday even updated some of the tests that are definitely not detecting Omicron. So we're keeping up with this as clinicians. And if you're in the right community with trusted resources, calling into your clinician and getting some kind of advice from our healthcare teams, because we're keeping up with this for you. But there is the need to test. So in that situation with younger kids, for example, you need to continue to provide the care. Newborns can't take care of themselves, right? But you must guide yourselves accordingly with barrier methods and wearing a mask and decreasing your chance of getting ill, especially if you're providing care. Because in some situations, there's just nothing you can do. When I have an employee who calls out because their child is positive and their child is a toddler or elementary age child, that employee could be asymptomatic and negative. They're out for as long as their child is out, because the assumption is that they're positive or have the potential to be positive. So there's that need to just kind of do the very best that you can under those circumstances, to provide care carefully in the household, and to test because the test will give you some guidance. And if you test and you are positive, then you use your test as the deciding date for how long you need to quarantine after your exposure. But the other thing is that there are often times, where, like I said, there are, you just don't have a whole lot of choices. And the only way that we know how to quarantine, is to keep those who are positive out of circulation. And unfortunately, I will tell you right now, one of the just heartbreaking things is that sometimes the lack of childcare, we've seen people in multiple communities, and fortunately there've not been any horrible things that have happened, but mothers and fathers are choosing to send their positive COVID children to school because there's no childcare or they need to go to work. And is that an ethical choice that's wise? Absolutely not. Is it horrible because of what could potentially happen to the teachers and others who may be at risk? Yes, but we know this is happening. So if we know this is happening, what can I do sitting in a classroom where my mother may not send me sick, but my classmate's mother may send them sick? In spite of whatever the recommendations are, mask. Send your child to school as protected as possible. Go to work as protected as possible. Walk the town center and the Avenues Mall as protected as possible. I'm seeing so many people who are completely maskless in our community because there's no mandate to do a lot of things. But common sense remains common sense.
Well, I think the people that I
raises the
know,
question, one of the people.
Wait a minute, one second, Dr. Kane, because I wanted to point out to Dr. Johnson, the people that I know who go out in the community without masks said, well, I've had my COVID vaccines. I thought I can go without a mask now. So now you're telling me I've got to go back to wearing a mask?
Yes.
And I said, yes, unfortunately, because not enough people have gotten vaccinated, and you don't want to be a breakthrough case.
And the terminology, we've had this conversation before, Jocelyn, about breakthrough, because you're breaking through from what? What was the vaccine supposed to do? The vaccine was never a mass thing, right? But here we go. This is one of the perfect examples of how we messed the message up as a healthcare community. We messed the message up. So people were not getting vaccinated, right? So we decided to hang a carrot for the American population and say, hey, get vaccinated, you don't have to wear your mask. Because at the time, Delta didn't exist when that recommendation came out, if you can remember. Dealing with the virus as we knew it and the pattern of that virus in our community, it seemed to be, a fairly safe way to encourage vaccination, not creating any undue burden. Once the virus changed, we had to backstroke on that very same recommendation. We had to tell everyone that we said it was okay to not be masked now that you're vaccinated. And it was simply because of Delta, because Delta changed the game. Again, now we have another looming variant and we don't know what that variant is going to do. So the lesson that we have learned, and that's why we're seeing the recommendations now for indoor masking and this resurgence of the same message, is because we got.
Let's not make the same mistake.
Right, we got caught with our pants down. I mean, essentially, we did the wrong thing. Okay. And so while our president sometimes seems like he's out there like on a limb, making these very strong recommendations, it's really so that, and some of it is a little bit of overkill, but it's rather in my opinion, it's actually there are decisions that are being made and recommendations that are being made in the interest of safety. It's not necessarily matched with the science. It's not 100% matched with the science, but it's better safe than sorry kind of policy making. And that's a hard pill to swallow when we've been told, get vaccinated, you can be unmasked. Well, that should never have been appearing.
Right. But we didn't know it at the time.
We didn't know it at the time.
We didn't know it at the time, in fairness. One of the listeners is in this climate of social political grandstanding, where can the everyday person go to get quality information?
Well, here you are already.
Florida Medical Society members.
Yes.
Northeast Florida Medical Societies. I want to give a high five to the Northeast Florida Medical Society.
And we thank you. Right. I mean, there are My father says there are a lot of educated fools. I don't think he was referring to me before he died, but not everyone that has a degree is
So
brilliant. So so I urge you to to test the fruit. So if you have trusted your medical team for other things, for your diabetic care, for your depression care, for your any care, that same team should be available to you.
Right.
If they say they don't know, trust that they don't know and ask them, where should I go?
Right.
If you're just going to Google, it's going to be a hard row to toe.
Nope.
So I think that you should look at opportunities like these to get information. And if you get information that lands weird to you, that's inconsistent with things that we've been saying or inconsistent with things that you believe, test that as well. And how do you do that? See if there's some corroborating information from other people. Go and ask a question. At least ask, what is the intent? What do you think the intent is? Because sometimes just asking yourself, and if it feels like that intent was weird, it probably was. And it's not easy all the time. So it's easiest when you have forums like these for us to give information. When it comes to just standard.
Oh no.
Yeah. Well, let me finish her sentence for her. When it comes down to looking to who to go to get the information from, trust your provider. If the provider doesn't know, there are some trusted websites. Okay, Northeast Florida Medical Society is one of those websites. But you can find a lot of information from other trusted websites. As in the Mayo or I'm talking about Mayo.
National Institute of Health.
National Institute of Health, the Duval County Pediatric, the Duval County Medical Society, the Northeast Florida Pediatric Society. There are a bunch of places that you can go and look that are actually medical websites, not those that are like Kim says, you got them off of Google, and it's somebody who's living in their. No, let me not say that. Somebody who happens to be just an a disinformation disseminator because they have a political axe to grind. So go to the scientists. Trust your scientists. If you trusted them, like she said, for your diabetes care, for your blood pressure care, then you should be able to trust them for your COVID care. And if you still have questions after that, then go to other websites, Medscape. There's a bunch of other websites that are proven to be scientifically correct. Even the CDC, you can go to their website, and it has places for the non-scientists to look up the latest COVID information.
And I posted, I don't know if everybody's seeing or if I'm just typing to myself, but the things that I just wrote are the National Institute of Health Community. Don't tell anybody. I'm at a loss for community engagement, COVID Engagement Alliance. I'm sorry, National Institute of Health COVID Engagement Alliance, Partnership for Child Health, Northeast Florida Pediatric Society, Duval County Medical Society, Mayo Clinic, Medscape, Baptist Health, St. Vincent's Health. I've noticed that all of our local hospitals in the Northeast Florida region has good information on their sites where you can get information. And also keep listening to us every Tuesday night, because every Tuesday night we are bringing somebody on. Dr. Kane is going to make sure that we sneak something in. Dr. Kane, I want to ask you real quick. You mentioned those 4 devices, the blood pressure machine, the pulse oximeter, the infrared thermometer, and the cardiac EKG device. What about vitamins? Because I know I started diligently taking vitamin C and vitamin D3. What do you also suggest that? And I haven't stopped, I just continued. Do you suggest those or recommend those as well? Or is that something you should discuss with your own provider?
One, yes, you go ahead and discuss with your provider just in case there's some other obscure reason that you may not be able to take those things. But the other part winds up being they are not in the place, they do not take the place of common sense approach to this COVID. Does not take the place of the vaccination. Does not take the place of mask wearing. Okay, I would ask you, if you asked me that question before COVID, fine, take the vitamins at the recommendation of your primary care provider or whomever may be asking you, your healthcare provider. So I tell you to go ahead and do that anyway. But I don't want people to think that just because you're taking a bunch of vitamins that you are COVID proof. Like you're bulletproof. You wouldn't take vitamins and say, here, shoot me in the chest with a 45 caliber bullet, because I'm taking these vitamins and it makes me strong. Don't do that with COVID.
So, Dr. Kane, there is an interesting comment that's been posted. I'm not familiar with the Population Research Institute, so I don't know if it's a reliable source, but the individual posted, COVID-19 vaccines are part of a larger problem, the abortion industrial complex and the immoral practice of biomedical researchers and the pharmacological industry. What, Dr. Johnson or Dr. Kane, do you have a comment on that?
I'm gonna let Kim take that. I do have a comment, but I'm gonna let Kim take it first.
I'm gonna say that I totally understand and get where the position that many people have about big pharma, the pharmaceutical company. There are things that are quite alarming in this COVID space. A vaccine costs $22 a vaccine. Monoclonal antibodies is like $2,400 for a shot. Some of our therapeutics is $700 for the therapeutic for 5 days of administration. So when you start talking,
can you also say how much blood pressure medicine is and Tylenol?
Right. So I want to
insulin.
Right. So, but I just wanted to say the kinds of things that I see and people are talking about. But I will say on balance that while that is kind of a polar position and it's not consistent with my view in the space, I do get how there are those who can see that COVID-19 is, so politicized that there are just people who are vultures and taking advantage of certain communities. Those are not my feelings. I want to say that as a scientist, as an island girl, as a person of color, I would not be in this space. I would not be on this panel. I would not have been vaccinated if it wasn't truly in the interest of my personal interest, my family's interest. And I would not be advocating for people who look like me to join this, come into this space. Like I said early, you cannot cut your nose off to spite your face, right? Sometimes the people who hold the gold hold the rules, and so we have to play some games differently. But in this space, this virus, this pandemic, this COVID is not a space that is the space of exploitation. We really do need to keep our political views in check. We can have them, but keep them in check when it comes to taking advantage of the things that we need to take advantage to live, to have an opinion about these things. For every one person that I tell you died, you can probably tell me 100 people who did X, Y, and Z and did just fine. 10 years from now, I don't know what the stories are going to be about the vaccines or about long COVID, but I have evidence right now about long COVID. I'm seeing the consequences of fatigue and cough and all of the complaints that my providers at my office are getting on a daily basis because of COVID-19. I don't have those things for the vaccine, outside of the expected. So don't cut your nose off to spite your face, as my old grandma used to say, because you don't believe or you understand that this is kind of the world that we're living in, where the economics is concerned. Be smart about this. Number two, I want to say that there's a lot that does not get discussed. And one of the things that Dr. Kane and I love talking about is not only viral genomics, but host genomics. I mentioned that my dad died 8 weeks ago. I buried him 6 weeks ago. And one of the startling things for me was going back to the Caribbean and watching a very masked community, obedient community, come to my dad's funeral. But then I started looking and digging deeper about why are brown people not dying like brown people in Jacksonville? Why are they not experiencing the burden of COVID the same way that we are economically? In fact,
Economically, they're probably more stressed. It was $9.99 for a pack of Oreos in St. Thomas. I would never eat Oreos if I had to buy groceries at home, right? So COVID meets you where you are, yet there are populations of people who are faring okay. So we are still studying the difference in host genomics. There are things about the makeup of each of us and groups of us and our hereditary that may actually have some protective factor. We haven't identified those things yet. And we haven't definitely said, because you have this allele on the 17th chromosome, you don't need a mask. We don't have that information yet, but it's being studied. Similarly, when we talk about a lot of the things that you hear about, right now, Dr. Payne and I talked yesterday about some of the more interesting grants that were available. So there's a question about menstrual cycle changes with COVID. There are actually studies that we're doing in medicine to see how COVID impacts menstrual cycle. We're doing studies to see what time of day the vaccine administration provides what level of immunity. There are so many behind the scenes studies and research. So what you may be hearing as just off the cuff, like, oh, that just doesn't make any sense, you know, infertility. These things are actually being studied. Before I come to you or Dr. King comes to you and say there's a valid reason or not a valid reason, we're looking to see what is the science that's emerging saying, and is there any relative proof or a reason for those conspiracy theories to be there. Most of the times it comes because somebody said something or had something, and we've got to separate everything else before we can blame COVID, right? So studies must be done and done properly. And there's a lot of complicated factors that influence science. You know, you got to tease everything out to kind of figure out what is the etiology or the reason for something to happen. Sometimes you just find that the timing is connected, but not really the cause of something. So we're doing this in the scientific space. It's not on CNN, not on MSNBC. It's not, in Black Blogs USA or whatever, but we are doing this as a scientific community, and we need you. We need you, the people of color, the people who are interested in being at the table with us, the people who are interested in learning and being part of these healthy and well-ran studies, to be at the table with us so that we can get this information. Because if I find that out for all the people in Jacksonville and it doesn't match the Caribbean people or people of African and Caribbean and Afro-Cubans like myself, like whatever your population is, and I later find out that genetically is different than another group of color of a different lineage. That's information that's valuable. So
that sounds like a plug for when we're asked again to participate in a clinical trial, we should say yes.
We should at least consider it.
We should consider. Now, I'm not telling it's not a plug, but to say that
not all, but I mean just still.
But yes, but we need to understand well-ran, safe trials. We should be at the table. When we first started doing this, you remember, Jocelyn, the first my papers that were like this were about how many Blacks, how many Hispanics, how many women, how many men were in studies. That's all everyone wanted to know of me as a researcher were there people who looked like me before I could use it? Well, right. Somebody who looked like you had to be in that trial for me to say it's safe for you. So we do have, I would love for all of us to be a little altruistic and giving, if we can, to be parts of those trials. But again, judge a fruit by fruit. Not every study is for you. But if you're going to look at groups like ours that are vested and involved, or you go with your research study to your primary doctor and say, hey, doc, do you think this looks like it's an appropriate study for me? It may provide you benefits beyond just the inclusion in the study. So I am a researcher, so that's my disclaimer. I do think that there's a vested interest for us to be part of that. But I also say all of that to say that those kinds of polar concepts regarding research, I usually have an answer to those things, and it usually it's just the science is the science. So,
well, again, the world in itself can be a test tube in terms of research. Mm-hmm. How many people participate in research about the hair dye? You have people that are anti-vaxxers. You have people that may be anti-vaxxers, but they dye their hair.
Mm-hmm.
And never really look to see what effect.
Weed.
Yeah, smoke weed and everything else. Never really looked at the effect of it. But yet they can be the population health researcher, whatever it may be,
Right. Mhm.
some entity that has been created
Well, let me tell
with
you, I think
information or has different information that it has out
I
there.
think the cannabis research in the COVID space is going to be interesting.
Yeah. Well, yeah, I mean, even that, some people may want to say, yeah, I participated in that study,
Believe me, I already have, like, I mentioned that jokingly, and I literally got phone calls and texts like, do you have a study for that, Dr. Johnson?
So you just never know. The
but-
bottom line is, and we're much past our time. The bottom line is that when it comes down to this virus, there are a lot of unknowns. We're trying to make them known as best we can. And the way to do that is through a strategic approach to to obtaining information and a strategic approach to the dissemination of information that is known and unknown. Because sometimes when you at least mention, like, we don't know the answer to it, we're being straightforward and honest that we don't know the answer to that. That does not mean it's ominous. The recommendation we make is somewhat ominous. So, with that, I'm going to let Dr. Johnson have her say her last words for tonight.
I can't hear you.
You can't hear us?
Can you
She
hear
can't
me?
hear us. No.
She was muted. Kim, can you hear us now?
No, it looks like she's having some technical issues.
Okay. Well, Ms. Turner, I'm gonna go ahead and wrap it up. If Kim gets able to hear me for any reason, she can interject. But it's been an exciting conversation. There are a lot of unknowns out there. We're exploring the unknowns because we're trying to research it and make it known for what's the best way to handle this pandemic. What we do know is that there is a pandemic out there and it's killing a lot of people. Even if it doesn't kill you, like a lot of my patients say, well, Dr. Kane, everybody's got to die from something. Sometimes you don't die and you just get very ill. And I have a lot of patients who are suffering from the proverbial long COVID, and it is just as devastating to them as as a stroke or anything else. So I just want people to be careful, try to make the right decision, go out and do and research legitimate sites, and hear what people have to say. Keep an open mind on both sides. You can keep an open mind, but when you look at making a decision, make it as scientifically based as possible. Not a gut feeling, not what you heard, not what somebody on YouTube said. If it wasn't from a reputable source.
We're not downplaying YouTube, by the way. We're just saying the point is on the World Wide Web. Dr. Johnson is back. Dr. Johnson, we were asking for your final thoughts as we near the end, as we wrap up today's discussion.
I just want to thank you all, just as an audience and as panelists, once again, for the opportunity to join in this space. Common sense is not common, and I just want to continue to celebrate those commonsensical decisions that each and every one of us who are out there trying to mitigate the risk for COVID are making. Remember that we are in a space that sometimes we don't make the decisions politically, but we still have the power to make decisions for ourselves. And I hope that people will continue to use common sense and to layer those factors that we can by masking, social distancing. We're going to get through this. God still sits high and looks low. We are going to get through this. And I do believe that we can get past all of the challenges that we have currently, but we are still in the midst of a COVID fight. And so as long as we're fighting, Dr. Kane and I and Jocelyn, we're all fighting together with you, and just trust that we will get through this and seek to be kind to those who may have difference of opinions, and one at a time. I think that we can definitely turn a corner on this thing.
It's too late for me to say anything then about Go Vote, but here in Duval County, I just want to be proud that I did vote. Exercise your rights to do so. If you didn't today, make sure you do so in future elections.
Well, I tell you what, I joined the show late tonight, but I certainly did not join a show that was not right on point. as we all continue to navigate this pandemic, first of all, remember that it's still current. Despite the fact that you see a lot of people out maskless, the pandemic is still current. And until more people are vaccinated, the variant may continue to mutate, which is why we have Delta, which is why we have Omicron. So please, 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 folks, consider getting vaccinated. If you don't know where to go, just simply go to vaccine.gov. You will find out where a vaccine site is near you and or a testing site. And if you have any show suggestions for Pause for the Truth, please, please send us suggestions to info@pauseforthetruth.com. As always, thank you to all of you for tuning in. We look forward to another discussion with a distinguished panel of guests on next Tuesday. Stay well, stay safe. Thank you, Dr. Kane and Dr. Johnson.
You're welcome.
Night,
Thank you.
ladies.
Happy
Thank
holidays.
you, Doctor. Thank you, Tyrone, our
Technology expert.
technology expert. We can't go.
Call Tyrone.
Right.
Just call Tyrone.net.
Call Tyrone.
I'm a fan.
Okay. All right. Well, good night.